resolution of cervical radiculopathic symptoms and restoration of cervical lordosis in a 20-year-old female. To report the successful treatment of a 20-year-old woman with symptoms of radiculopathy in her left upper lateral extremity and reversed cervical lordosis. Her symptom resolved entirely, along with improvement in physiological cervical lordosis seen on radiography after chiropractic care. A 20-year-old female university student sought care for a complaint of nonspecific, gradual onset, intermittent neck pain and numbness in the left lateral arm and forearm related to prolonged computer use for about 7 months. Pain was rated 6/10 on the NRS scale. Physical examination showed reduced cervical rotation to the left by 40 degrees and a myofascial trigger point without a referral pattern in the musculature around her cervical region. Joint play of the cervical facet joints revealed generalized restriction of motion of the lower cervical spine, especially prominent on the left. She had a positive Spurling test on the left side of the left lateral forearm and thumb and a positive cervical distraction test. Radiographs of her neck demonstrated reversed cervical lordosis, with no obvious bony degenerative changes. The working diagnosis of cervical radiculopathy of the left C6 nerve root was given based on her presentation. Chiropractic spinal adjustments, mainly diversified technique, motorized flexion distraction with extension force on the cervical spine, and therapeutic exercises were performed. The patient's numbness was completely resolved by the 5th visit. The cervical range of motion, ROM, returned, and she was pain-free by the 8th visit. Reassessment in the 9th month demonstrated restoration of the cervical lordosis and sustained treatment outcome. Our patient demonstrated improvement in the cervical lordotic angle and upper limb numbness after treatment. Chiropractic care can play a role in managing patients with one or both of these conditions. The associated recovery of the cervical lordotic angle and radiculopathy after chiropractic care suggest a plausible biomechanical mechanism and a potential connection between the two conditions. This study is published at Journal of Contemporary Chiropractic at Parker University.